Kush, then they smoke am plenty. They make them dey craze. So Kush na dangerous drug. E don dey plenty now anyway. My name na Dr. Edward Nahim. Me na consultant psychiatrist, and mental health problems na serious problem all over the world. In fact, dem say 1 in 5 people dem get mental health problems. And we sef we get plenty number na so we get mental health problems. For deal with them, it's very difficult. Then they go to traditional healers, to religious healers, so then they come to me for treatment or to the Kisi Mental Hospital for treatment. Well, we get mental health drugs then who they use in Sierra Leone. Cocaine, then they traffic them from Latin America through Freetown to Europe. Heroin from the Golden Triangle of Laos, Burma, Cambodia to Freetown to Europe. Then we been a grow jamba where people them smoke and then they smoke them very well and very cheap. So don't get this new drug what they call Kush. Most of the patients they admit in a mental hospital, na drugs they carry and go there. The one they kind of the Egbakoh Street Mental Health Clinic. Kush also, then they smoke them plenty. They make them dey craze. So Kush na dangerous drug. E don dey plenty now anyway. E not too there yet. And e very available. Na smoke then they smoke am. When you smoke am, it dey affect your brain. E dey make you know dey think properly. E dey make you dey hear voices them. E dey make you dey see strange objects. E dey actually craze. When I say craze, you dey go mental, complete mental. If they no admit you, they no give you treatment. I not say you go die, but it go affect you for quite a while. But if you stop am, maybe after some time, you will get better small bit. You will know what they call withdrawal symptom. That means to say, you dey tremble, you dey shake, you get for take am back. And when them patients here get withdrawal symptom, whether they want Kush or not, then they go take them back, then they feel better. So Kush is something very addictive. Addictive means if they take them regularly, if you not take them regularly, you get serious problem. Social media is exposed now. All man in social media. The one they take Kush, then can also go on social media, then they talk. But most of what they talk na rubbish talk, then they talk. When they talk, then he forget what they talk about. Then they begin all over again. We don't get case inside Kush make person get mental illness where he go kill person. Now themselves then they unbug themselves. But then get club them. Inside then they go smoke Kush. Then get them jamba put them. Formerly na jamba them they smoke there. But now I think say Kush himself did it. So you can choose who I want, whether na jamba or na Kush. But na Kush people then like more because it's very strong. And when you take them, they feel very high. They feel fine. They make you sleep well. They begin to hallucinate. They see strange objects. You hear strange voices. You see devil then. You feel to say in a big man. You get plenty money, we not get nothing. Past one tell you go thief money for go buy the Kush. Kush was past the all. Kumbe jara na drug also, wouldn't they smoke. But a mild, much milder than Kush. Kush for some strange reason is very, very strong. It's strong past jamba maybe twice. So if you take them, you craze quick. Whereas jamba now, if you take them for some time before it begin affect you. They're all cheap anyway. Kush expensive past jamba, but not so plenty money you forget for who buy them. Now cocaine and heroin, now they're very expensive. We people are not they buy soon. But this is not for export mostly. within the transit and ISO. Well, I don't know whether they import them, but you get people that they traffic them drugs. Government import drugs for treats normal patient them. But then drugs of abuse, na traffickers. When they traffic and they know they count money. When you want money, then give you the drug for money, you go sell it now. So na so dem dey pass through this Kush and then other drugs. Yeah, so we get the National Drug Law Enforcement Agency. That's not the government agency for drug abuse control. But for controlled drugs, it's very, very difficult because then people are so the amount of money we they make from them drugs here now millions of dollars. I dey repeat, millions of dollars. The number of mental patients on drugs they don't increase. Today, they no be dey come with drug problem, but now you ask them about drugs, then they tell you they take Kush. Today na jamba dem dey take with rum. Alcohol also na drug. When you drink plenty alcohol, it can make you crazy also. The amount of drugs is plenty now. You get jamba, Kush, alcohol, rum, cocaine, heroin, and I don't know whether the group Kush Nayasu 8. Now import them, they import them, but me no know whether they import them. Now mostly young people then. Mostly the average age na 25 years. Old people then get sense. Then if they get mental problem because of stress, stigma, social problems, because they don't get plenty money, then can make them get serious mental problem. But then young bobo then now, they know they work, then they go thief them parents their money for go buy drugs, and that can lead them to serious problems. Well, for treat them na the same amount of treatment. You dey do counseling. Counseling mean to say you dey talk to them about the dangers of all them drugs there. Then we get what you dey call psychotropic drugs. Then a tablet so they give them. Then they make the brain function normal. Then they sleep well. If they craze self or them want for craze, the craze go come on at their head, then go well. Don't if you get good parents who they monitor them, then go be normal again. But if you take treatment, without treatment, no way, no, you no go better. The age of the people where they kind of young people, young now mostly boys them. I not see any girl yet who come with push business. Age 18, 19, 20, up to 30 years maximum. To push no more than can take go. They take Kush with one back. Anybody who didn't at the military not for take drugs. Now then they control the people who they take the drugs. You see, because if you take the drugs, then a serious problem. Kush can make you go fat. When you fat, then go lock you up. When they lock you up, the withdrawal symptoms begin to camp on you. Then you will begin to ask for Kush. You see, but they never give you Kush. After some time, without the Kush, you will feel bad anyway. It will left you after some time. Well, the transit actually is illegal. Governments no get hand pan one day. And for control them is very, very difficult. Because then people and the way that they traffic them drugs from Latin America, now they ship them in bring and come, don't then pass and through Freetown, get and go Europe, Europe to America. Because when he come out na Freetown, they're not going to say we'll get them kind of drugs than this. They're not can search them properly. And the same thing with heroin also, where they come through Laos, Burma, Cambodia, to East Africa. I no one call the plane where they can also. But I one plane from East Africa where they come direct Freetown, from Freetown now, then carry and go Europe. But some they left as payment. But you already left, you not plenty because we know we for buy them. It's very expensive. Now mostly for go sell with man country then. You don't get serious mental health problem. Plus the cheap drugs like alcohol, rum. They don't take rum no more. Then they take rum, then they take jamba, then they take kush. If you take then three drugs here, then definitely you get serious mental health problem. Wey go make you go craze. No, well, I no get any patient wey dem say kush kill am AIDS because when e dey affect you, you dey stop for take am. Say when dey begin get the withdrawal symptoms, then you begin take am back. So not to think wey e no dey kill so no more. E dey make you high, and when you high you stop. Na so dem can normally do. And when dem stop, dem can feel fine for some time till dem begin feel bad.